Thank you, and welcome to CBTS Tech Talk. Today we'll be talking about optimizing and securing an evolving patient experience. And as always, I am joined by my esteemed colleagues, Justin Rice and John Lloyd. Thank you, gentlemen, for joining us today. And Justin?
Yeah, thanks, Lance.
Yeah.
Good to be here with you again, John, and Lance is our producer. You always do a phenomenal job. Today we're talking about the evolving patient experience in healthcare. We're going to touch on a few different topics, anywhere from flexible network to unifying collaboration tools, pretty much the whole gamut of what we see from call it a communications perspective in the healthcare space. Let's start, John, with talking about flexible network in healthcare, especially as we've seen over the last few years. A lot of that has changed with remote offices, work from home, doctor's office, hospitals, and really that network topology that changes across all those domains. What do you see, John, in that space?
So it's interesting because in the past, healthcare typically is pretty steady from a revenue stream, right? You've got Medicare, Medicaid, these sorts of things. Right now, you're seeing a large kind of cost cutback or a cost spike in healthcare, and a lot of it's driven by staffing costs, right? Mm-hmm. Traveling nurses that we saw come out of the COVID pandemic and the cost associated to that. So the cost for them between inflation and the cost of talent, both are going up, but you have these government contracts that you can't raise rates. This need for flexible, whether that be extending your talent pool to hire from, whether it be centralizing certain job functions to combat, I now need 6 people to do the job that I used to use 30. The other thing that we're really starting to see is healthcare start to really look at their business units from a more cost center or profitability center. And how do I start to build not just this one network? Because the whole network's important and everything's a hospital. Well, now we're really looking at what is the cost? What is the cost to build a doctor's office that's open 8 to 5, the same way that I built out my hospital core, right? My acute care facility. And so the idea of flexible networks really is looking at healthcare. How do I bring the network to the job function that makes sense? That job function might be a high revenue, like an MRI facility, or it may be, how do I connect to my contact center working from home so I can find a wider talent pool and keep my costs down? Or how do I centralize nurse functions to have some folks bedside, but really centralize kind of the nursing command center across all of my facilities? So I think flexible network in healthcare is always something that wasn't needed because the money was there and it was easier to just say, let's build it all the same and treat it all like it's a hospital. We don't have that luxury anymore.
Yeah. Well, and it does, I'm going to pivot on that a little bit because it does seem like even with you and I talking to healthcare clients a number of years ago, especially with the advent of SD-WAN, the start of our conversation was really around, hey, there's cost savings in this kind of network deployment. But what I hear you say is, as time has evolved, really we're mainly talking about ubiquitous access.
Yeah, in the past, the first days of SD-WAN, and you and I always, we were there on the front lines, and everybody would run off, the OEMs, marketing would run off and go, you're going to save 30%. And that wasn't what it was designed to do. Sometimes that was a byproduct, but the buzzsaw you would run into is then you'd run into a healthcare system and go, we're going to save you money. And they go, okay, how? Because I have a local Metro E network. It's a gig up, a gig down. It's fiber-based. It's SLA driven. And I'm paying like $200 a month per port. And you're like, oh. I'm not going to, right? A lot of that has changed, and I think we'll talk about today. The patient experience has changed. The patient experience is no longer within my 4 walls. So now all of a sudden, my private layer 2, ELAN, E-line, VPLS technologies aren't delivering the same thing that they used to be delivering for me. But I think that's the big concept is all of a sudden building out networks for healthcare. They have different job functions than they did in the early days of SD-WAN, where it was, well, you can save money. Well, not for healthcare.
So let's talk about that patient experience then. You and I, for years we've talked about, what are you hiring your network to do? Yeah. Well, you're hiring your network to give to help, supplement the patient experience, right?
Yeah, think about what do you do when you offer Wi-Fi? What do you do with switches in your network, right? Mm-hmm. There's this conception of like, well, it's to get to the internet. Well, no, the internet is a transport. VPLS is a transport. It's how do you connect your employees to an application? And healthcare has this really unique use case of how do I connect my patients, my customers to care, right? And care used to be this patient experience was simply, okay, I come into the building. Well, then it kind of moved to everybody started doing telehealth or telemedicine, which was one aspect. But what about the other parts of the customer experience or the patient experience? Things like in an urban area, knowing what does parking space look like in a downtown where I've got to go pay for parking, or I don't want to drive down for care, not be able to find somewhere to park. So how do we utilize the network? How do we utilize artificial intelligence to help drive this patient experience to know what facility should I go to? What's the wait time right now? What's the staffing look like right now? The patient experience is always around us, and it was led by telehealth or telemedicine. But I think in general, how do I interact with you when you do come in, or how do I drive you in? Those things are really important.
Yeah. Connecting the customer to care is a really good way to look at it. And the network has a key role there.
Yeah. I mean, and think about talk about getting connected to care. Have you ever gone to visit a hospital or somebody in the hospital, right? Sometimes it's bad, sometimes it's good, right? Having a kid, childbirth, things like that. They're not the easiest to navigate. So it could be something as simple as wayfinding, something as simple as delivering, what are wait times in the cafeteria, or what is the experiences around me, the best place to go to the gift shop, being able to get from, we took your loved one down to radiology, or there's going over here. Simply navigating what are kind of these metroplexes, we're seeing far more patient experience being delivered with, call it an intelligent hospital in the app, right? I've got an app when I'm on campus, and it helps me with my experience while I'm there.
Yeah, that's fair. Well, let's then take that over to the collaboration piece. What I often hear, John, is that customers have this ambition of having a unified collaboration platform, whether that's been Cisco in the past, Microsoft Teams, whatever the platform is. Everybody seemed for a long time to have this common goal of a unified platform. Well, what I see now in 2022 is customers saying, listen, I made this investment in Microsoft Teams. I want to use Microsoft Teams for my care facilities, for my employees, both at the office and at home. Can I unify on that platform? And I think what we've seen is there's this hybrid option, and that unifying may not be all that ready yet. Is that the best way to ask that?
Yeah. So here's the challenge. It kind of comes back to what's the job to be done. Most healthcare organizations, security is paramount, right? I've got to worry about HIPAA and PCI and PHI and all of that, right? Well, what do I consume for that? Well, Microsoft's E5 license, F5, E5 license. I want some of these security suite. Well, if I've already consumed that, what do I get? Right? I get voice. That voice license bolt-on is included. So we are seeing a push, because not just in healthcare, but of E5, F5 subscribers wanting to take advantage, especially because their employees have gotten so comfortable with Microsoft Teams as a vehicle to communicate, working from home and working from their phone. However, there is a administrative aspect, an office aspect to healthcare, and then there's a healthcare aspect, meaning what is that enterprise class solution? So Microsoft looks at, I'm helping employees connect each other. I add voice to it. I've got the licensing. They weren't necessarily looking at the same level of enterprise survivability, right? And so I think that is really where we look at building a hybrid solution of, are we connecting employees or to patients? What does the contact center look like? And that's typically a third standalone piece. So it's designing for survivability. Not all sites are created equally. How do we, hurricanes, floods, power outages, right? Obviously what's going down in Florida and Tampa right now. How do we build those hospitals so that even in the event of these catastrophes, they're able to still conduct business while also putting in place utilizing the license of E5 for my everyday office workers? And then my contact center, right, goes back to patient experience, being able to call and do centralized scheduling, be able to have conversations with the financial department, and all of these things always on 24/7.
So what does that look like in real terms of a deployment? Like, what does that look like?
Yeah, so the first thing starts with centralized call flow, right? Centralized dial plan. Now, you can do that yourself on-prem for organizations that want to manage that. I have a session border controller. I have some kind of communication broker, a layer running over it that takes E164 numbers, maps my 4-digit, 5-digit, whatever my extension dialing plan is. Or where we like to help customers is call that traffic cop in the cloud, right? So we've got this North American-wide SIP core. We're connected into all of the tandem switches across North America. We are a SIP provider. And now I have the ability, utilizing my enterprise session border controllers in my core, I can build a SIP trunk to Five9 or Genesis or NICE, right? Whoever your Twilio, your third-party contact center, I can build a SIP trunk to them. I build a SIP trunk to your on-prem environment, your legacy environment that hasn't been removed yet. I also have SIP trunks to Cisco WebEx calling. I have SIP trunks to Microsoft Teams calling. And so me being that traffic cop allows me to do a single number reporting event, or maybe I do 3 or 4. You get my point, though. And now I can, from the click of a button, decide where I point that trunk, and then we bring automation into it, right? We can run automated scripts that say, if I can't connect this way, move it over and point it to a different trunk. So if my contact center is down, for whatever reason I can't get to that contact center, don't fail those calls, run a voice XML script and start sending it to, the hospital front desk. So I think it really starts with understanding. I always say every employee is a PBX. That's one of the conversations we have with customers. As soon as my phone's now on my cell phone, my desktop, I've got a hard phone, I work from home, I work from an airport, I've got to design a voice solution that meets the needs of every single employee. It's a PBX in my pocket. And so I think we take the approach of not everybody is going to have the same need and so the same solution. So how do we create one underlying or underpinning technology that allows you to freely move?
Yeah, what I think I heard is like with healthcare specifically, the user personas are unique enough that the technology solutions that exist are going to differ. And with the traffic cop idea in the cloud is, okay, that's fine. We're okay with the personas being vastly different because we're going to match the right technology with it. And by the way, we're going to manage that up in the cloud.
That's right. It's creating one underlying technology and then plugging in a purpose-built OEM into that ecosystem to meet the unique needs of each persona or job function or employee, right down to the single user level.
Yeah. One thing that I've kind of struggled with throughout that model is, what do you do around HIPAA or PII, BAA? Like, where does that fall into this multi-platform approach?
Yeah, I mean, so one, obviously having a partner that even just beyond understanding the security or the encryption requirements for voice, but in general, a security partner that can look at your entire ecosystem, right? Because everything is a culture more than a checkbox. So is it encrypted? Is it TLS 1.2 encrypted? Sure. Is it encrypted at rest to meet GDPR for your stored voicemails and call recordings and things like that? Sure. All of that is possible. But also, what are, so we've got these independent CBTS is HIPAA compliant, Microsoft's HIPAA compliant, Cisco's HIPAA compliant, your contact center's HIPAA compliant, and then all of a sudden your employee is having a phone call on speakerphone with 30 people around. Well, all of that money spent on certifications and encryption just went out the window, right? So I think, partnering with somebody that understands in general the sensitive nature of healthcare security, doing security assessments and helping build out that culture and build out a game plan, but certainly making sure every leg of the hop of the call is HIPAA certified is certainly important.
We tied the network into patient experience. Let's tie the collaboration into patient experience. What are you seeing from the clients that you operate with on a daily basis, how they're leveraging telephony to bring forth a better patient experience?
Yeah, so I think in general, nobody likes waiting in a waiting room, right? Yeah. I used telehealth. My daughter was sick last week. We went online. We scheduled a telehealth appointment. It was an hour and a half later, and we sat at home watching Disney for an hour and a half until it was time for our appointment, and we were able to get a antibiotic over the phone, go and get it filled. So that whole process took what would have been a stressful, annoying sitting in a waiting room. Why isn't it my turn? Somebody more important has come in, ahead of me. Sort of frustration. And it's removed that. So I think the idea is I want to be able to get access to care wherever I am on my own terms. Mm-hmm. And from a physician standpoint, I want to be able to take the same advantages that everybody else has gotten over the last 2 years of being able to go on a road trip and still work and take advantage of, having a vacation or, Airbnb and getting out and kind of getting some sanity. And I think that whole idea of telehealth has not only allowed a better end patient experience because it's when I want it, where I want it on my terms, but I think it's also created this environment where healthcare can kind of centralize job functions and help keep costs down. And again, that's a huge deal right now because healthcare is getting inundated with rising costs and they don't have a mechanism to turn and pass that on like most industries do.
Well, let's talk about the costs. So, we've seen the ebbs and flows of the economy over time where IT organizations have capital-friendly budgets, they have operating expense-friendly budgets. Where do you see the world going as far as, in healthcare specifically, around a utility model type service for network security, telephony? What does that look like?
I think it goes back to what I said earlier around healthcare is really looking differently now at the jobs to be done, the purpose of each building. And really, when you take a look at healthcare, you realize, well, I've got this data center infrastructure. Maybe that's still in my data center. Maybe it's moving to the cloud, but I build that like it's a data center. And then I've got these giant hospitals, and I basically build those like they're data centers. And then maybe I have medical office buildings that are higher revenue. Maybe they're open more hours, critical functions, CT scans, things like that. And then I've got these physicians groups, right, that are really not to take away from what the importance of the work they're doing, but from a networking standpoint, it's like retail. They're open 8 to 5, Monday through Friday. They've got 4, 5, 6 office staff. Mm-hmm. The impact of it going down versus the cost to keep it networked up. And I think we're seeing more and more organizations start to move to a predictable model, right? Healthcare always would budget 1/3 for a refresh and do that every 3 years. Well, the costs are mounting. So it's certainly one way to defray some of the unexpected costs they're seeing over the last 12 months is to move to an operating model. But also really looking at, I think we see a lot of businesses, and it's catching up to healthcare, of looking at it and going, is this strategic? Is this intellectual property? Is this important to what I deliver? Or is it really just inflating my payroll, creating headaches for me? And so we're seeing much more, this is my data center, these are my hospitals, but this part of the network, you might have 10 hospitals, 2 data centers, and 300 doctors' offices. We're seeing those doctors' offices move to much more of what you would almost consider a more retail model of consumable operating IT.
Consumable operating IT, which means predictable monthly cost. That means almost a managed service partner that is an extension of your team. You have a flat rate that goes per store and per office, and you just kind of know what that's going to be long term. And oh, by the way, the life cycle is managed too.
Right, and then that office staff is calling us, right? The office staff isn't calling the IT department and opening a ticket and somebody coming out, right? It's proactive monitoring and management. It's taking those calls 24/7. It's building in, DR plans. Once that voice moves to the cloud, now all of a sudden I can redirect those calls other places. We're seeing central, scheduling starting to really take hold. So I think, it's understanding what is it that I need to do and be responsible for, and what's kind of become a commodity.
Yeah, and the differentiating operating models is really interesting that you say, like, you have the hospitals, you have the data centers that may follow one operating model, one financial structure, where all of your doctor's offices distributed everywhere could follow a completely different structure, and that's okay.
Yeah, and it's not a one-size-fits-all. I mean, there are some that have capital budgets. Capital budgets have been presented for 3 years. Yeah. So I would say there's 2 aspects. So one is the operational as-a-service networking of kind of a fixed, predictable monthly, and that is meeting some needs. I think there's a much higher take rate right now in general of just the idea of outsourcing things that aren't important. One, cost of talent is rising. We see that across the board. Are you coming into the office? Do you allow work from home? Do they need to be local? So we're seeing people get hired away, especially in the tech space. It costs more to keep your talent. Yeah. Why not have a managed service partner? And then I don't have eggs in the basket of the guy who left. Second thing is, in the past, one of the big deterrents to I want a managed service partner was no. I want somebody that's going to be here every day, see my lights blinking, hug my server when I need it. And now we're saying, well, to stay competitive, we need to hire somebody from all over the country. So now somebody's 8 states away. How's that different than, a managed service in that regard? So we're also seeing, hey, we've got the capital budget, so we're going to go ahead and buy this hardware, but we don't want to manage it. We don't want to continue to staff up. We don't want to continue to have to chase open headcount and recs every time somebody leaves and goes somewhere else. And think about what you can do when your core IT staff is supporting 2 data centers and 10 hospitals and not worrying about 300 noisy, physicians groups who can't conduct business if something's down, putting that out to a managed service partner. So some of it is the financial model. A lot of it is simply getting that headache off my operations, for sure.
Yeah, exactly. Very cool. Given we have about 10 minutes left, I would be remiss before we get into questions if we didn't touch on contact center. So contact center, as it relates to patient experience specifically, I know what I'm seeing a lot of is organizations continue to use contact centers for omni-channel customer experience, whether that's patients, whether it's not, but omni-channel is a big thing. What do you see in this space?
So omni-channel is obviously a big thing, but integration to EHR, right? EMR, right? The ability for me as a patient, I go to this hospital system, right? And in some parts of the country, we haven't seen it as much, but for the most part, you've kind of seen certain emergence of certain hospital systems kind of gobble up some of the smaller practices. Right. And so all of a sudden, I'm in network. My general care physician's in network, but also my surgery that I had done was in network, and my wife gave childbirth in network. And so you should have this comprehensive view of me, my family, of what's going on. And that's kind of the expectation, right? There's still my provider, when I have an appointment, I have to fill out online. Now it's not the piece of paper, but it's still the medical history. Have you ever had this? Have you ever had that? Have you ever had this? And then I get into the office and then they go, please fill this out. So now I'm doing it two times. Well, what's the point of that? So I think the idea of when you look at contact centers, it's not just omni-channel, meaning I can get to you if I want to call, if I want to chat, but also how do I get to you with all of my records? And so that means into Cerner or Epic, integration into that so that I have this single pane of glass.
I call you look up that I've had these 5 procedures. Here's my family history, everything available because the integration exists as soon as I call inbound to your contact center.
Yeah. And you see who my doctor is, who my primary care is. You see, what my insurance is. No, it hasn't changed. And so I think that's the thing is getting people access to care without sacrificing, obviously, intimate knowledge needed to care for them. And so I think in contact center, I have the expectation that it's always on, right? Meaning I might have an issue or an emergency at 11 o'clock at night. I want to be able to get a hold of you. Like, gone are the days of calling the nurse line and leaving the voicemail and hoping they call you back, right? The idea is between telehealth and centralized contact center, I should always be able to get to somebody and get guidance or information or, knowledge that I'm looking for. So I think omni-channel and omni-connected to other, billing platforms and EHR and EMR platforms.
Now, is that standard today in contact center technologies, or are there a few, partners out there that we see that do that very well?
So the key is it's API, right? So it's the contact center can only be as good as what is the underlying, and we see Epic and Cerner as typically the big two in that space. Yeah. So in Epic, they call it the apple orchard, and so we partner at Five Nines. They are kind of the Gartner Magic Quadrant, the Cadillac of contact center, and integrate very well into Epic, but also very well as an omni-channel or a standalone. There's plenty in that space. I think it's really looking at what is the use case. For us, we look at Five9 and their kind of cloud-first strategy and commitment to integration into our network, our SIP core, integration into Microsoft's application in their network, Cisco's application and network,
the unified
Epic,
cloud experience,
right? And I think that's the big deal is looking at do you want to utilize the Five9 agent application? Do you want that to be a plugin into your Epic portal that I'm working out of there? And I think that's the key is working with a contact center partner that isn't one size fits all, but is really, hey, we take this API cloud-driven approach, integration approach, and work with you to really customize it. Because my guess is if there's 1,000 hospitals all with a contact center, all 1,000 of them look completely different.
Yeah. Once again, we've touched on the patient experience with contact center, which is the theme of today's call. I would really like to go to questions now if we have any on board. It looks like, let's see, we don't have anything coming through yet. Great. If you have any questions, please put them into the chat. We have about 5 minutes left. John, before we go, though, do we have any parting thoughts?
So I think, what we've talked about today is things that have already existed that have, I don't want to say healthcare has been resistant to, but maybe they didn't offer the same benefit to healthcare as they did as other verticals.
Yeah.
Now we're seeing things differently post-pandemic, whether that's because of the cost constraints that I mentioned of traveling nurses and inflation and not having a vehicle to pass it on, or if it's simply people walking away from a very stressful, high-demand, in-person job like, critical care nursing into another line of work. We saw a lot of that as well. So I think really we're seeing all of a sudden these things that have always existed that healthcare were always like, we had other solutions for, all of a sudden start to bring value. Where I'm more excited about, and we didn't really necessarily talk on too much today, was where is the next phase in healthcare, and how do you start to around IoT sensors? What does that bring around biomed devices? All of a sudden, with connected devices puts a lot of strain, right, on my wireless networks. I got to start looking at what does Wi-Fi 6 bring into that? Where do beacons and this infrastructure come into play to be able to offer artificial intelligence, better cameras, smart cameras into my hospital, a fall detector, right?
Yeah.
Instead of there are people who are fall risks, and hospitals will employ a person to sit there around the clock with them. Well, all of a sudden, what if that person now is sitting at a control center and can see 300 rooms, and as soon as a patient falls, not only does it alert them, but in their natural language that they had registered with in Epic or Cerner, play a recording that says, "We know you've fallen. Please don't try to get up. Somebody's on their way." Or these are what is really possible. And I think there's some buzzwords, right? And I think that is far more exciting as where is the application space going? Where's the AI space going? But it does start with the infrastructure. I've got to have the infrastructure in place.
Yeah.
Hey guys, I do have a question here. Looks like I've got Kenneth is asking, don't you feel that an assessment of customer contact is obviously contact center, but also health system customer app interactions that include health system websites? Then he goes on to say, assess the security and customer sat when they are interacting with all omni-channels. That should also include SMS, web, and apps, an overall assessment.
Yeah, so I think I'll try to decipher that. I think what we're talking about is the omni-channel experience, right, in the contact center of, again, being able to reach you how and when I want. So I've got an app on my phone, and that has my medical chart, and it's got my billing. I also can immediately ask a question from that app to my doctor, to my past primary care, whatever that looks like, and store that history as well. Obviously, we need to do so securely, right? HIPAA's been at the core of all of everything we're talking about. But I think that's the whole concept we were talking about. I need my contact center plugged into all of the tools so that I have a holistic view, a 360 view of me as a patient. What does my time in network look like? Yeah. But also, how do I have a persistent chat so you understand what are the experiences I've had via SMS? What are the experiences I've had via phone call, right? I mean, that kind of all goes into that omni-channel of being able to connect with me when and where.
And it sounds like validating. So those APIs have to exist, right, for that connection to happen. And something that is important for us or anybody to do is validate the security measures. You have the right API keys, right encryption standards. All of that has to exist really before we'll sign off on an integration.
Yeah, and now you have API gateway is kind of the new API, infrastructure design principle, which adds a lot of value. Also, some would say adds a great deal of compromised risk. In that approach. So there's pluses and minuses, but I think in short, the world is moving to API, and the OEMs that have embraced a co-opetition model are the ones that you're going to see continue to succeed and rise. The ones who have dug their heels in and said, full stack, it's better. The more you buy, the better our solution gets. Yeah. We aren't going to play nice. This is proprietary, or have said, you know what, we're going to get into that space. And so you have, firewall vendors trying to become voice vendors, right? I think the ones that focused on partnerships and building best of breed are the ones that you're going to see succeed. And part of that, obviously, in contact center, what I love about it is they aren't trying to be a cloud PBX. They're focusing on their contact center.
Yeah, exactly. Well, my closing thought here is, and first off, before I get there, Lance, do we have any more questions?
No more questions, but I do want to give a shout out to Kenneth there. He mentioned that he liked the session a lot and great value that CBTS brings. So thank you, Kenneth.
No, thanks, Kenneth.
Yeah. Cool. Thanks, Lance. Well, my closing thought is, we talked about today when we opened up the segment around the patient experience. You said something early on around, it's really about connecting your customer to care. And it feels like everything we talked about today helps support that. And it's really just a foundation, meaning the art of the possible to come. There's some really cool stuff coming, really cool capabilities coming, but the foundation has to exist. And, it's been very informative for me, John, so thanks for sharing all of your insight.
Yeah, I'll part with this. We have a lot of organizations we work with in different verticals, and speed to market, iteration of application development or iteration of technology refresh and things like that. Take retail, driven at making more money. What I love about working in the healthcare space is every enhancement we make, every technology we enable, every experience is all driven at their customer, not spending more money with them, but having a better health, a better experience, a better life. And so it's much more, not that I don't enjoy the tech work on the other
But
side.
it's rewarding.
But it's very rewarding.
Yeah.
And I love working in healthcare because every advancement we make is to make somebody's life better, not just make another sale. And that's really cool.
Yeah, very cool. All right. Well, thank you, everybody, for your time today. Again, thank you to Lance for being the producer for today. And thanks to Gabby from our marketing department for organizing everything. John, thanks for your time.
Absolutely.
Oh, shucks. Thanks, guys. Take care, guys.